Hi, my name is Jordan, and I am going to demonstrate a PICC line dressing change today. So we're going to start by looking at our MAR. And we see that Joseph Smith needs a dressing change. It's been a week. So we are going to go in and get him changed out. For this procedure, we have a central line dressing change kit, a tape measure, a mask for the patient, an extra set of sterile gloves, just in case we need them. I brought a little bit of extra tape, and I have some clean gloves here. All right, so we are going to start by knocking on the door. Hi, Mr. Smith. My name is Jordan. I will be your student nurse today. I'm here to do a PICC line dressing change for you.
Hey, Jordan.
Provide for some privacy. Can I get your full name and date of birth?
Sure can. Joseph Smith, 3/1/1968.
All right, that matches the wristband and the MAR. And any allergies, Mr. Smith?
Nope.
No? And that also matches the MAR, and I do not see a wristband. All right, well, we are going to wash our hands and get started. So for this procedure, I'm going to need you to wear a mask. If you cannot wear a mask, I'm going to ask that you turn your head to the side and away from the procedure for the entire duration of the procedure. Would you just like to wear the mask?
Yes, please.
Absolutely. I will get the mask on Mr. Smith. And that is when I will open my sterile field, and I will get my own mask. All right, we are going to ditch this MAR, give ourselves a little bit of room. All right, and rewash our hands. And get some gloves on. All right, how are we doing today, Mr. Smith?
I'm doing probably better than I deserve today.
Oh, well, that's good. So we're going to start by measuring from our insertion site 6 inches up the arm, and then we are going to measure the circumference of the arm to check for phlebitis, infiltration, or vascularization. All right. Everything looks good, and we also are going to measure for placement. Okay, and that looks good. So we are done with this measure for now. Set that to the side. Okay, and during this procedure, we may or may not have changed our caps on here according to agency policy. But we are going to get started with the change. All right, you ready, Mr. Smith?
Oh, yeah.
Awesome. So we're going to start by removing this tegaderm, which may take a second. And depending on the age and the skin integrity of our patient, we may use an adhesive remover to make sure that we get this off without impairing their skin integrity. And making sure to work from the outside in. We will also remove this tape and ball that off. How are we doing, Mr. Smith?
I'm doing good.
Awesome. We're going to be making sure to note any kind of drainage that we see on the dressing while we're removing. And after, we are just going to be taking a look at the skin integrity under the hub. Okay, everything looks good. How are we doing, Mr. Smith?
I'm doing okay.
Awesome. Okay. Do you feel any tenderness or pain?
Nope.
No? Perfect. And we are also going to be assessing at this point for redness, edema, ecchymosis, drainage, and making sure we have appropriate approximation of our PICC line, which we do. So at this point, now I'm going to get my sterile gloves on and start doing the cleansing. Any questions, Mr. Smith?
No.
Oh, okay. We are going to wash our hands. We're going to get our sterile gloves on. Making sure to get them as close as we can at this point, and we can always manipulate them once we get both of them on. Those seem a little small. And in this case, this would be where the extras came in handy. Alright, and we are going to start cleansing the site. So I am going to grab my chlorhexidine wipe, break it, and now we are going to scrub the site making sure to do it for at least 30 seconds and creating friction. Okay, and then we are going to throw this in the garbage, but in this case we are holding on to this because this is from the school. And while this dries, we'll get our skin prep prepared. This is now dried. And we will cleanse the skin around the site where we will be placing our tegaderm. Throw this in the garbage. We will now be switching out our gloves from sterile to clean. How are we doing, Mr. Smith?
I'm doing good.
Well, making sure to wash our hands. Awesome. I know it gets kind of warm in these masks sometimes.
It's a hot in this for sure.
Well, we are just about done, believe it or not. So, some hospitals have you place a bio patch, but in this case we are not. So we will just place that to the side, and we will place our tegaderm. All right. Making sure that everything is placed firmly. And when we place this tegaderm, we also want to be sure to label with the time, date, and our initials when we insert or when we place this, so that way they know when the next cleaning needs to be done on it. So next we will grab our tape. Tape down the lines. Making sure not to place it on the tegaderm itself. And as I said earlier, sometimes during this procedure we would also be changing the caps out based on agency policy. How we doing, Mr. Smith?
I'm doing great.
Awesome. Everything's looking good. So I'm going to remove my clean gloves. wash my hands, lower the bed from the comfortable working height, and make sure to remove the masks of both me and Mr. Smith. At this point, the wound is covered. Making sure, like I said, hands are washed, the bed is lowered, call light is within reach. Mr. Smith has no questions for me. I will now go document the time, the date of insertion, and I will also document any assessment findings as far as the COCA, the color, odor, consistency, and amount of drainage on the original tegaderm that I pulled, and any redness, ecchymosis, edema, drainage, and the approximation of the dressing or the wound itself. That's how you change the PICC line dressing.